Coming up on Nursing Success TV. This month, Dr. Phyllis shares strategies on handling bullying. And in part one of a special interview, nursing expert Dr. Tim Porter O'Grady shares a glimpse at the future of healthcare.
Ask Dr. Phyllis is brought to you by New York Presbyterian Hospital. Amazing things are happening here.
RN Earl in Nebraska writes, "Until you experience nurse bullying, you can't imagine the stress. I'm constantly criticized for everything I do, and I'm no rookie. I have been an RN for 10 years. I'm surprised and frustrated by the negative treatment from both my supervisors and coworkers. Sometimes I feel like quitting."
Earl, I am so sorry to hear that you've been working under such conditions. This is a subject that's really near and dear to my heart, and I want you to understand something about bullying. It's not uncommon, and it's not acceptable. You have the right to work in a healthy work environment. Working under such stress tends to focus your attention on just getting through the shift, and that is no way to practice, and certainly no way to be able to deliver safe, quality care to your patients. I'm not sure how you've managed for 2 years under these conditions, but you allude to the fact that your supervisor is part of the problem, so the question I need to ask is, are you aware of your facility's policies and procedures on workplace violence, and have you spoken to anyone in human resources? Most facilities have a zero-tolerance policy for such behavior and abuse. You showed a tremendous amount of courage and integrity, but you need to start putting your own needs first as well. Please, take good care of yourself. It may be time to transfer to a different department, or it may be time to leave this organization altogether and move to a different facility. Whatever you decide, I wish you well.
Email your questions to AskDrPhyllis at nursingsuccess.tv. Health systems consultant, educator, and author Dr. Tim Porter O'Grady shares the path he took to make a difference in the healthcare system and the changes nurses can expect in the future.
I was not a high school graduate. I was actually a high school dropout and made bad choices as a child and wasn't sure what direction to take. So I was exploring some counseling. And so while I was reflecting on that, a friend of mine who was an engineer decided to go to nursing school. And in it, we had some conversation and he said, "Tim, you should really think about it. I think there are a lot of alignments here." And so I went to the nursing director and she said, "This is one profession where if you try it, you'll know early whether it's not a good fit." So I tried it and here I am. It was 44 years later, it was a good fit. When I graduated, I was really excited about the choice that I'd made. I never have ever in the whole of my career regretted my initial choice. So I was excited about that choice, and then I went to work. And I began to get a sense that the same excitement and enthusiasm with regard to making a difference and be positioned well to influence and to make good decisions with regard to patients wasn't nearly as well developed in the work environment as it was in the educational environment. And that was kind of the start of it all. I decided to go back and get my BSN. And it seems that once I got on the educational trajectory, the track, the more I learned, the deeper I drilled, the more interested I became, and then it became something I think essential to my own career advancement as I began to realize I really want to make a difference in the system. Well, there's probably 3 major shifts that nursing is beginning to experience now and will experience over the next 20 years. The first thing that I try to tell nurses is that you're now going to spend the next 20 years of your career in health transformation and reform. So most of the work that you're going to be doing is adjusting, adapting practice to an entirely different setting for practice. The second thing that is really important is that most of our career as nurses to date has been spent in a kind of an institutional environment. I usually say when I became a nurse, I came into healthcare as an institution. It was fixed, it was finite, it was functional, it was institutional. That was the system I came into. And now we're quickly moving into a healthcare system which is fluid and flexible and portable and mobile. And therefore, the practice that we learned in this fixed environment now is going to have to be much more mobile, much more portable, much more patient-centered, much more non-institutional, which brings us to the third piece. Instead of looking at nursing practice in terms of clinical events, like diseases and treatment and surgery and intervention, we'll now be looking at our practice in terms of the continuum of services for particular populations of patients, so that we'll be organizing care horizontally along a continuum instead of vertically within the context of a particular event. And that's going to be a huge shift in the mindset, the mental model, and the practice definitions for nursing practice. And those three drivers are going to be pushing us into that new world for the next 20 years.
On our next episode, we continue our conversation with Dr. Porter O'Grady and explore opportunities and the role of nurses in the future of healthcare. Thanks for joining us today. Click the banner below this video player to share your ideas and suggestions for Nursing Success TV. We'll see you next time.